And during these times of uncertainty, feeling hopeful can be tough for some people. In fact, a new study by Wellbeing Trust suggests that 75,000 Americans are at risk of dying from suicide or overdose as a result of the coronavirus. Joining us to talk more about that is Patricia Rehmer, Senior Vice President of Hartford HealthCare and President of the Behavioral Health Network. Thank you for being with us again, Patricia.
Thank you for having me.
Your message is so important. So the growing number of unemployment, economic downturns, and stress caused by isolation could increase the deaths from despair. Can you talk more about that, please?
Sure. So obviously this came out as the prediction of what we could be facing. I think that it's our intention to try and make sure that we bring those numbers down. But as people are losing their jobs, facing financial insecurity, perhaps facing food or housing insecurity, isolated at home, perhaps with family members in very tight quarters, we are concerned that people will begin to feel depressed or potentially use more substances, which is another risk factor for suicide. And so it's really important that if people are experiencing difficulty, not sleeping more than usual, not eating more than usual, periods of sadness, perhaps spontaneous crying, it may be time to reach out to somebody and ask for evaluation. Behavioral health services at Hartford HealthCare and across the state are open, and I think that we are available to do evaluations through telehealth or in person, but we are very concerned about this number.
And I think that the message of "you're not alone" is so important. So Hartford HealthCare has a large behavioral health network. What are you seeing right now?
We are seeing people call for services, and sometimes just to kind of check in. Do I need to see somebody with us? We are continuing to do evaluations. We are continuing to see new outpatients. And if people need inpatient hospitalization, we have beds that we can utilize across the state. But again, not everybody needs to be hospitalized if they're experiencing depression or suicidal ideation. And so it's important that people understand there is help out there. And the most important thing for all of us, but for people who are struggling, is to try and maintain some sense of hope.
That's so important. All right, so who is this having the most negative effect on? Are we talking about those already suffering from addiction or mental health, or those with no history?
I don't think we know that yet. We are getting a lot of calls from people who don't have a history, but we are also watching our current patient population that we treat very, very carefully, and maintaining a lot of contact with people who are in our outpatient programs. We are concerned that people are isolating and perhaps abusing more substances.
Let's talk a little bit about younger people. They experience this too, or they might sense it from their parents. Talk about younger people having this all impacting their mental health.
Yeah, I mean, I think that's critical, right? So our kids, our children and adolescents are not in school. They are not interacting with their peers as much as usual, which is really important to especially adolescents. And so I think trying to find creative ways to allow your kids to interact with their peers is critical. And also making sure, if at all possible, that you're not conveying too much anxiety about the situation, which I know is a challenge. But I, again, encourage people to turn off the TV for periods of time during the day and try and distract themselves.
All right. And Patricia, let's talk about your healthcare workers. How are you guys doing in your department with behavioral health?
In behavioral health, I think we're doing pretty well. We have a lot of staff members, again, working from home who are doing evaluations via telehealth. I have more concern about our frontline staff in our ICUs, in our emergency departments, in our CCUs. And we have a colleague support line set up for them. And we are reaching out in different ways to try and help support the workforce, who is doing just phenomenal work, but it's very overwhelming.
Oh, I'm glad to hear that. I know that you announced that helpline last week or the week before. I've lost count, but that's so wonderful that you provide that. Patricia Rehmer, thank you so much again for taking the time to talk with us today. We appreciate it.
Sure. Thank you.
Thank you.